Hello, everyone. It's a day with your fertility specialist. I'm your host, Ruth Ogogo, for the show today. On behalf of Alps Hospitals, we love to say a very big thank you to our viewers. Thank you for liking our post. Thank you for sharing. It's always good to have you join us in our live session every Wednesday. Today we have a very amazing person with us today. We have a very beautiful guest. She's a guest with this tease and whatever it is you can call composure. She has it all put all together. We have Dr. Jane Ojani. It's good to have you, Dr. Jane.
Thank you very much, Ruth. It's nice to be here.
Yeah. So, dear viewers, for the sake of someone watching for the first time, just in case you don't know who Dr. Jane is, let me just tell you a little about Dr. Jane. She's a consultant gynecologist, a very good one at that. She's a minimal access surgeon. She's also a fertility specialist. Wow, it's good to have you, Dr. Jane.
Thank you,
And I'm sure
Ruth.
they are happy to see you. I'm
Yeah.
sure I was not wrong with all I said. It's obvious. You can see she's very beautiful and she has composure. Oh, yeah. Dr. Jane with these teas, like I call her. Okay, so today we're talking about gynecological screenings and fertility. A lot to be talked about, and we have Dr. Jane here to tell us a lot about some of the screenings that people need to know to also know their fertility status. It's not just for the women, it's not just for ladies, it's for both gender. Or maybe the transgender too.
Oh my
Oh, that's
gosh.
just on a lighter note. That's just on a lighter note, though. But yes, we're talking about screening today. So, Dr. Jane, I know that when people hear screening, a lot comes to mind. So maybe we should narrow it down to what are the basic gynecological screenings that you think people should consider doing, or let's say, let me talk about the women first. What are gynecological screenings that you would recommend for women in their reproductive age?
Well, thank you so much. Gynecological screen is basically are just things you do for a woman to
Mm,
detect abnormalities generally.
mm,
Well, a lot of times when people hear screenings, they always think of cancers. But well, yes, when you screen, you also pick cancers early or pick things that pre-cancers. But there are other things you can pick that would
mm,
also affect fertility and all of that.
yeah.
Commonly, we'll talk about pap smear. Pap smear is one of the common gynecological screening and is recommended for every woman from the age of 21,
Oh wow.
irrespective of when you had your sexual debut.
Okay.
Once a woman hits 21, without even she's not had any sexual exposure, she
Yeah.
should start having her screen every 3 years or maybe after 30 with some other screens alongside. We
Okay.
also talk about screening for sexually transmitted infections.
Okay.
These also have long-term effects. I think maybe we'll talk about that a lot more going
Mm,
forward. But those for people that have multiple sex partners
yeah.
or even those that have new partners, because these have long-term effects on
Mm,
fertility.
mm,
We also talk about pelvic exams.
okay.
Yes, you don't have to go doing pelvic examinations like putting, but if there are indications, women that have chronic pelvic pain, people that have irregular periods and all of that, in those gynecological screenings that they have, you can pick some of those conditions and also they
Okay.
have impact on fertility.
Mm.
Then what about breast exams? Breast exams are also to be done. Yes, women are taught how to do self breast examinations
Nation,
and other
yeah.
breast conditions that can actually affect their fertility. So there are a whole lot of investigation. Yes, when we talk of screen, not just necessarily tests. There
Mm,
are other things you can do
we
without
do.
just running a test, and you help you pick a whole lot in an individual.
Okay, so can we narrow it down to fertility? What are certain tests, or what are certain tests that you think women in reproductive age can actually use to ascertain their fertility status?
Well, fertility status.
Mm,
First, again, Yes, we are talking about tests. We can do blood tests.
Okay.
We can do what we call imaging, like
Okay.
ultrasound scan,
Okay.
hysterosalpingography. So the blood test basically would help us pick what we call ovarian reserve.
Okay.
Also helps to tell us if a woman has ovulated or if she's ovulating or not.
Okay.
So some of those hormones can actually be assessed, like what we call the follicle stimulating hormone,
Okay.
estradiol,
Mm-hmm.
um, progesterone for women that have, that tells you if a woman ovulated or not. And of course, we know that a woman that doesn't ovulate might not get, cannot get pregnant because it's the eggs that release that fertilized.
Mm.
Then under ultrasound scans, we can pick things like fibroids. We can pick conditions in the
Mm.
ovaries that can affect the woman's fertility, cause some kind of miscarriages, recurrent miscarriages, and even those that have chronic pelvic pain. Then we
Mm.
can also do what we call hysterosalpingogram. Is a special kind of X-ray that is taken to
Yeah.
line the tubes to
Okay.
see if the tubes will spill the dye that will be injected into the womb. That
Mm-hmm.
also tells you if the tubes are open or not.
Okay. Oh,
So
wow.
commonly these are tests. Then you can also run some blood works. Some blood tests can affect a woman's ovulation,
Mm-hmm.
like people that have thyroid problems, high
Mm.
prolactin, and all of
Yeah.
that. So it's a whole lot. Some of those blood tests can also pick some of those conditions early.
Okay. Well, this is me just trying to play around. So yesterday I met someone that said that she's very fertile. That's
At the sight of
that is just meeting my pregnancy happens. So, so are there things that make people to for you to know that okay, this person is over fertile, this person is not fertile, like the layman would call it.
well, commonly below 35, most women their fertility is usually at its peak,
Peak,
and
okay.
so that makes them prone to, well, they can easily get pregnant,
Okay.
or
Mm.
well, depending on their reproductive wish at the time.
Mm.
But you cannot, so a woman that ovulates to you tells you that a woman that has regular periods, that tells you that a woman, that's a pointer that a woman that ovulates. Because those that have regular periods somehow have what we call hormonal imbalances, polycystic ovaries, and all of that. And that
Mm.
has a way. So unless you can determine if a woman ovulates or has regular periods, and you are sure she ovulates, then you are sure that the woman is going to get pregnant whenever she meets. Of course, high fertility is with the younger age. Of course,
Age.
20, 23, 25, peak of it. We're going down to 35, it drops a bit. After 35, women's fertility naturally drops to a
Drops.
level. So
Mm.
fertility, conception becomes a bit of a challenge.
Mm. Okay, so now speaking of regular period, you have people that will tell you that I see my period every month, and maybe now hits the men because you hear some women say, I see my period every month, have been meeting my husband, pregnancy is not happening. They've checked my tubes, they say no problem. They've checked this, they say no problem. So you do not wonder, is it that the woman is not fertile now, or there's a problem with the man? So are there some things that men too used to know, okay, they are fertile and all of that, yeah.
Well, commonly for men, the commonest cause of infertility in men, because a lot of times is people tell women go for fertility checks, fertility, and
Mm.
all of that. But it's very important that we know that 50% of the problems with infertility in a couple
Yeah.
is also is from the man.
Man.
So,
Mm.
and commonly reduced sperm count or low sperm count, what we call, yes,
Yes.
is one of the reasons for infertility in men. So common tests that will show if a man has fertility challenges, you want to do semen analysis,
Mm.
and for some men too, they would need to do some of those blood works because
Mm.
you might see hormonal imbalance. You
And
can
all
also have
that.
problems, and they can have some other genetic conditions that make them not even produce sperms at all. So you pick all of those from those blood works. Then some men will also need special scans, always
Mm.
check the scrotum, because
Okay.
sometimes they have these large veins
Okay.
that can affect sperm cells that
Wow.
form. So men too need to be assessed, not just women. So it's a two-way thing.
Yeah. And so for a woman watching right now, yes, you might be seeing your period regularly and you feel like you're fertile. Like Dr. Jean has said, we have to be sure that you're ovulating. So the fact that you're seeing period, we have to also be sure the quality of eggs that you're also ovulating to be able to achieve pregnancy. And all that is done with having your evaluations with your fertility specialist or your gynecologist. Okay, so another question I was going to ask: at what age would should women start their regular gynecological checks? Because it's awkward when you just tell a 16-year-old you should be doing this every year or every. Well, oh yeah, I might be wrong, but maybe you could just help us have that understanding and clarity.
Well, it is stated that for every adolescent, your first gynecological visit should be between the age of 13 to 15 years.
Okay.
And at that visit, like we have talked about pelvic exams and all of that, not necessarily invasive,
Hmm.
but you want to talk about menstrual health,
Hmm.
educate them about their reproductive health because they are just starting the reproductive journey. And if they are picked early, some of
Yeah.
these conditions that would eventually affect them would be averted. So we talk about that, but generally, it's advocated that from 21, women should have
Okay.
yearly gynecological checks and visits. Doesn't
Okay.
have to be invasive examinations, blood works, but discussing these hormonal imbalances, your menstrual health, and all of that could guide your management subsequently when
Yeah.
you have problems with fertility and all that and all that.
And okay, so speaking of when you talked about adolescents, I remember I think I visited my first visit to a gynecologist was when I was 14. And yeah, when I was
In the age
14.
bracket.
So yeah, so oh yeah, so it's not strange when you have an adolescent. So people that think it's awkward if a young girl sees a gynecologist, it's not awkward, it's not strange. Yes, because I remember then, I think 14 or so, I was just barely in boarding house, I think. Yes, about that. So
Okay.
it's not strange when you have people of that age see. So you don't say it's just for the adults. It's not just for the adult. They
Yes.
might have a reason. What if there's cessation of period and you're not understanding what's happening for a child that has actually had minac already, and then suddenly there's no menses and the child is not even sexually active for you to think pregnancy and all of that. So you see, in fact, once there's pregnancy, it means there's still a reason to say gynecologist because the person has already seen her
Yeah.
period apparently. Yes. So how do this screening help in early detection of some of these fertility related issues? How do some of these screenings that they do help identify some of these issues? Or maybe before we take these questions, are there some things that people are experiencing that you would recommend that you don't just stay and wait? Because like you said, they could check themselves yearly from when they are 21, and then maybe, just maybe, this person has had her annual check, and then she's experiencing something. Does she have to keep waiting till
Another.
another year? Like, so are there some things that you think that people, ladies, are experiencing that they shouldn't just stay and wait for when it's their routine checkup? Because I've heard some pregnant women saying they're experiencing something and they will now say, today is not my appointment day. And then they are waiting for when it's their appointment day. So do you think there are some things that ladies are experiencing that once they experience such, they don't have to wait? They should just go ahead and check themselves.
Yeah, there are a lot, a whole lot. Just like the human body is not fixed on one problem. So you
Mm,
might see the doctor today and everything is fine. Tomorrow
mm,
you might begin to have your period and all of a sudden it's flooding. You don't have to sit till you maybe collapse or something. You come
mm,
to the hospital, and that is why it's very important that for every appointment you have with your clients, you let them know that yes, you're fine today, but you can have a problem in the next 2 3 days, and we
mm,
expect you to call back or come back to the hospital so you can get checked.
mm,
So women generally might have yes, they see their periods, you might begin to have unexplained acne or pimples all over, then all of a sudden your appointment was 2 months ago, then the next 3 months you're
yeah.
beginning to have heavy periods, you are
Mm,
beginning to have significant abdominal pains or lower abdominal pains,
yeah.
abnormal vaginal discharge. Yes, all these things were not there in your last appointment. So you
Yes,
don't have to
that's
sit
true.
for any condition you notice that is not keeping with what is normal or what is expected. Please do see a gynecologist because early detection would help with appropriate treatment and that improves your quality and your fertility choices or chances in the future.
Well, so you see that you don't have to wait and then keep waiting for such a long time. Problems can develop. You can see a doctor today and then tomorrow something has gone wrong. So you really don't have to wait. And then, because I actually, I yes, maybe I will get to the point of fibroid, but I know someone that when she was 20, she had to have a fibroid surgery. I think before then they had identified fibroid, but how would they have then identified this fibroid if they had not taken her? I mean, she was young, she was innocent, but the fibroid doesn't choose. They say bad things happen to good people, so it doesn't choose really who. But I think it's from regular checks that they were able to identify that they were fibroids. Yeah, they were trying to see if they could manage, but it really became disturbing as her period became very heavy. So they had to take it
Yeah,
out. Yes, so that was for someone that actually identified. So nobody is really too young per se. Like you have,
very true.
there's no age that you say, okay, you're too young, you have to wait till so time before you start getting your checks regularly. So
Very
let's
true.
come back to our questions. How do this early check help to detect some fertility issues that might arise, or that if they didn't know on time, it could have actually resulted to something that would be very, very, should we say, that could jeopardize their fertility and all of that.
Very true. So, very important question. So, for all the conditions you had listed earlier that we
Yeah.
could screen for, those gynecological screens,
Yeah.
now we're looking at pap smear, for instance.
Mm.
Pap smear is a kind of a screening test to help detect pre-cancer of the
Mm.
cervix conditions.
Okay.
So it means that if you don't screen regularly, you can develop the cervical cancer.
Cancer.
Now,
Wow.
the treatment for cervical cancer has to do with special X-rays called radiation,
Mm.
chemotherapy, and all of these things can cause what we call scarring or narrowing. So you
Mm.
see that sexual activities will significantly be reduced. There can be
Yeah.
blockage of the cervix,
Mm.
and this can also lead to extensive surgeries like taking out the uterus, the cervix, and all of that. And
Mm.
this can affect fertility. We mentioned sexually transmitted infections.
Yeah.
Yes, early detections would help with treatment, and once it's well treated, you can be rest assured. But when someone doesn't have regular checks, it just sees every discharge as ampiclox for ampiclox,
Because that's
yes.
a regular
Every
drug.
discharge is for ampiclox, yes.
Mm.
So you can now have scars in your
Mm.
uterus or in the womb, in the tubes, and even you can have pus form in the what we call the pelvis. Is like a bowl holding all the reproductive organs together. You
Mm.
can have pus in there that eventually, when it heals, can make the whole organs to form like a ball.
Mm.
So now the freedom of the tubes, so we'll call it a frozen pelvis. So the
Wow.
freedom of the tubes, the eggs to move and
Wow.
cause conception and all of that will be significantly
Oh.
reduced. And that's where we'll have all
Mm.
the blocked tubes you are talking about and all of
Mm.
that.
Wow.
The pelvic
Mm.
exams we do, you can pick fibroids.
Mm.
Fibroids can be located at the entry of the cervix where it can prevent sperm from entering, can be
Mm.
at the tubes where it prevents the sperm from moving to meet the eggs. You can also do your regular exams for a woman that has chronic pelvic pain. She might just have endometriosis. Endometriosis generally would cause abnormal um, coming together of the organs like
Wow.
adhesions, same
Mm.
frozen pelvis we are talking
Talking
about.
about.
So
Mm.
for every condition, then people that have abnormal breast milk discharge, talk about breast conditions, though not necessarily directly related, they can
Yeah.
have breast milk discharge and all of that, and all those can affect ovulation. So once you
Mm.
have your regular checks, these things can be picked. Even the breast cancers, you
Mm.
can pick breast cancers that can affect your hormones in a way and
Oh
also
wow.
affect fertility. So women have to be checked regularly for early detection and prevention of a lot of
Wow. So,
fertility related problems.
yeah. So viewers, you see that early detection is key for you to salvage a lot of things, and yes, salvage your fertility as a whole. And that's why you don't overlook any symptom you're feeling. It's better they say, Madam, you too do. Or you too complaining. Or you complain so much. Let the doctor even say, I'm tired of seeing your face. And let them identify what the issue is, than
Very
for
true.
you to just assume it's normal, and then you just relax, sit back, and then things are getting bad, and then it gets to the point where it's really like it's not redeemable anymore. So early detection is key, and that's why you would have to maintain your regular checks. Breast self-examination, even now in secondary school they teach them how to do breast self-examination, so even secondarians can actually pick to know when there's a lump. I mean, some children are even the ones that they will tell their parents that, okay,
There's
I
something
noticed, I
here.
know, I noticed this, I noticed that, and
Yeah. I've
the
seen a few
society
of them.
that we are in right now, a lot of disease, no, they fear children again. Like But the one that is for the adults is hitting the teenagers,
Very
hitting
true.
the adolescents. So that's why, even as much as, yes, as a parent you're checking yourself, you should also check your children, because nobody says they cannot come down with infections. I
Very
mean,
true.
yes, so that's why you should consider all of that. Okay, so now, I know you talked about from 21. Now, are there, by the time a woman gets to 35, now age, because I know you mentioned that a woman's fertility drops very drastically at 35. So are there specific screenings, or are there special screenings you would recommend for women that are over 35, or women tilting towards menopause? Yes, are there some that you think is very peculiar to this age? Yeah.
Well, basically, we are looking at their ovarian reserve because
Okay.
we know that that would significantly drop. We're looking at anti-Mullerian hormone,
Okay.
intrafollicular counts on the
Mm.
ultrasound scan. We're looking at blood works, follicle stimulating hormone, and all of that.
Yeah.
All would help tell the woman um, if her ovarian reserve is good, of
Okay.
course, because as it's dropping, it also has a way of affecting your fertility. So
Mm.
basically, then with age again, a lot of people are now at increased risk of some of these metabolic conditions. A lot of them have hypertensive problem or
Problem.
hypertension,
Mm.
diabetes. Well, thyroid problems not necessarily with the age, but with increased age, a lot of medical conditions or metabolic problems, as we would want to
Come on.
say, are
Mm.
increased. So you want to screen for all of those. Then over 35, there's increased risk of chromosomal problems if they
Mm.
eventually get pregnant. So they need to
Pregnant.
also have prenatal screenings and all
Screenings.
of that. So
Wow.
it's a
Wow.
whole lot,
Hmm.
yes.
So that means even when they are pregnant at that age, you would when it's spontaneous, you might want to check for maybe some congenital abnormalities even in the course
Yes,
of their
yes.
pregnancy.
Chromosomal anomalies is a lot is higher with them. So
Okay.
prenatal screenings will go a long way to
Mm.
help pick some of these, then counsel them appropriately.
Okay. Well, so a lot. So we're picking some of these informations, and these are really crucial. A lot of things that people suffer from if they are actually been regular with their routine checks. Some of these things would have picked on life could have guaranteed in a way, but some people just ignore a lot of self. As a matter of fact, I think recently I saw a post on online when you mentioned ampiclox. You reminded me of a post, and they attributed. They said ampiclox. This is a death sentence right now. Anybody that takes ampiclox, this can lead to death. And I was like, some people just some of these things we know that they are for gain if they want to demarket a particular product. So when you said that, that was just the picture that came to mind. Yeah, they were talking about a particular brand of ampiclox, amoxicillin, and all of that. Well, that's just by the way. But all she was saying was some people do self-medication. It's not everything that you just stay and say, okay, or maybe you tell your friend, she now says, this is what I've experienced before. Then you now say, okay, it's the same thing that I'm experiencing now. She'll now say, what's the name of that drug that the doctor prescribed for you?
Yeah,
Or waiting with that help where you take. Then they'll now go and take it. And then
yeah,
the next thing, you are even aggravating issues because it just feels like you just took a medication. You're not addressing what's the exact issue is. So viewers, it's something that you shouldn't play with as much as possible. Try to stick to your routine checks with your fertility specialist or your gynecologist. You don't have to have fertility issue. Even if you have finished giving birth to all the children you're looking for, it doesn't mean you're it doesn't rule you out of checks with your gynecologist. It still keeps you in check to be able to be sure that, I mean, we've seen a lot of women in their reproductive age, even after they've given birth, that still come down with cancer. And these are some things that maybe if they had routine checks, they could have been identified.
very true.
Yeah.
So just to add to that, so we don't the ampiclox issue. Ampiclox is a very good antibiotic
Mm-hmm.
for many medical conditions,
Yes.
but however, there are condition specificity, and you should treat appropriately. And so
Mm.
we're just trying to discourage self-medication.
Medication. Mm. So hope you noted that. Nobody's saying ampiclox is not good, please. Okay, so how do lifestyle factors uncovered? Because I know that in the course of your experience over time, there are some people that when you do some screening and you find out some results, you get to know, okay, their lifestyle, and you start asking questions like, do you smoke? do you drink? How do you attribute some of the lifestyle to some of these investigations that some people do, and how best they can work on their investigation when they start having things like maybe obesity, hormonal imbalance, and all that? How do you?
Well, basically, when you uncover some lifestyle issues that could have well with affecting their fertility, so the best thing at that point is counseling. So
Okay.
the patient needs to understand why I need to stop taking alcohol.
Mm,
Patient needs to understand why I need to reduce my cigarette smoking.
mm,
Patient needs to understand why I need to work on my weight. Commonly with women with polycystic ovaries, even as little as 5% drop in their weight can improve their
mm.
chances of
Wow.
ovulation and
Mm,
fertility. So
wow.
it means that your lifestyle choices would have a turnaround if you have an understanding of these common problems that can be prevented if you work on. So you just improve lifestyle. Then for those that significant stressors, because stress has a significant way of impacting fertility too, you want to advise them on how to manage stressors, how to speak with people. Those that multitask can decide to
Mm,
give people some jobs to help them run and all of that. So once you pick these problems, basically you just speak to them. Most times, once people have an understanding of a problem, see, an understanding of problem is almost like 50% solved. Yes, because
yes,
commitment
that's true.
to improvement and all of that would
Mm.
improve. Yeah.
Okay, yes. So, are there some symptoms, or is it true that, because some people feel like if everything is fine, or if they assume everything is fine, they really don't need to check. So is it just people that feel like they're having a regular period, or people that feel like, okay, my mother had fibroid, so it's possible I might have fibroid, maybe I should start checking? Is it just those people now that are in the category for check, or everybody, you think everybody should actually have this check?
Well, it is recommended that people should have regular checks. And for us in the gynecological space, we talk about yearly from 21 years.
Okay.
And you don't have to have the problem, or the problem doesn't have to be there for you
Mm,
to have regular checks. The good thing with regular checks is that when you pick a problem, eventually you can say from what point. So that stands as your baseline. So I see you 1 year ago and there's no fibroid, no things. Then I
yeah.
see a fibroid next year. We can track from this point. Okay, this is how it is. Okay, the growth can be this. Can we do this? Can we do that? Okay, I'm not ready. I'm ready in the next 6 months and all of that. So you can track, you can look back and know when the problem started. Just like every other condition, even heart conditions, you see young people
Yeah.
slumping and all of that. It's from because we don't have that culture. And
Mm,
currently there are even apps that now send reminders to people.
people.
Yes, there are places now they send reminders for your pap smear, your breast
Wow.
exam,
Wow.
your blood works, and all
Okay.
of that. Once you
Wow.
have all of those, you don't need to have a problem. You just
Yeah.
need, at least for every time you check, you know that okay, 6 months ago my sugar was fine. It
Mm,
means maybe this diabetes is at this point, I was fine. So it doesn't mean anything, but it gives you a baseline. So you're not
mm,
struggling to think, probably was here 2 years ago. Maybe that was why you had this condition and all of that. You're
mm.
fine from that point here.
Okay. So now you're speaking about the symptoms and all. Are there some misconceptions that you think people have with regards to gynecological screenings? Because some people might have wrong notions, like I just mentioned. Are there, so what are the basic, based on your experience over time, what are some of the misconceptions that you think people have with regards to checks and their fertility?
Well, some misconceptions that I think some people hold, or what they think they know. Well, they think that most fertility challenges or problems are
Yeah.
incurable.
Okay. Mm.
Well, some people think that anything, things can just be done. Things cannot, nothing can be done because they have
Mm.
been told of unexplained
No,
infertility
no,
and all
that.
of that. But
Mm.
that is not the case. Then basically people just think that once you have a problem, there's no solution. I have a
Mm.
fibroid, I must bleed, I don't get pregnant. But that's not true.
Mm.
Yes, sometimes some women
Mm.
have fibroids with pregnancy.
It's
Some
true.
think that this medical condition, this PCOS, I'm not going to get pregnant because my sister
Ah.
suffered. But surprisingly,
Oh.
they have erratic ovulation, so they might
Mm.
just get
Yes,
pregnant when they are
exactly.
not ready.
Wow.
So most times the misconception is just about not having knowledge about
Yes.
what to
So they
expect
assume
and how to go,
wrongly.
and they just assume that this problem is bigger than
Mm.
any doctor.
Okay.
Yeah, but
They
I
feel
think
like
there's
it's a sentence already. So
true. Yeah, so there's solution for everyone.
Okay, so viewers, so it's good that you don't just assume that because you feel this might be there, that's just how it's going to be, and then you've already given yourself, should I say, a life sentence, and you just say, okay, this is how it is. It's not, nothing can be done about it. There's still always a way, and that's why it's good that you have your checks, so that if there's a problem, it's identified on time and it just probably can be salvaged on time before it gets really bad. So I while I was preparing for this, I saw some of the gynecological checks that people check, that I saw something about hysteroscopy. That could be one of the things that you could do in your field. So maybe you could tell us a little about that and how it relates to women and their fertility. When do you really recommend that a woman has hysteroscopy in the course of her fertility life?
Well, hysteroscopy is not a procedure that maybe you would routinely do when women are having their gynecological checks. But if a woman comes to the hospital with a complaint that is
Okay.
related to the uterus, the
Okay.
uterine cavity, and all of
Yeah.
that, so the hysteroscope is just like a telescope that helps you
Okay.
to look directly into the uterus.
Oh
So it
wow.
tells you where the problem
It's
is.
coming
She could have
from.
a fibroid, she could
Mm.
have scars in her uterus, she could have a
Okay.
polyp. So depending on the
Mm.
condition you find, you
Oh
can
wow.
treat at that
Okay.
setting and conditions improve.
Wow. So women should not also feel like it's just out of the blues when a gynecologist recommends that in the course of their visit to the hospital based on their complaints. It's not strange, like she has mentioned to us. It's just one of the modalities that they use to check, but it's not like she has told us. It's not something that you just come and be doing every day. You just come and meet your doctor. I want to do stereoscopy.
Uh, Even
Dr.
though
J.
there's office hysteroscopy for some conditions, there's also hysteroscopy you do in the theater, but
Okay.
it's a readily available procedure
Procedure.
and it solves a lot of problems that are not visible to the eyes, naked eyes.
Okay, so okay, so now I know we've talked a lot about the women. Maybe we should talk a little for the men, because I know sometimes men just feel like at any age they feel they can impregnate a woman. It's just men have that notion most times, even though yes, a lot of things are evolving and changing, and then some of the notions are changing, but are there some things, because sometimes too women are the ones that really fight to treat infection. Men, most of the times, I don't even know if some of them even know when they have infections. So they just feel like if they say the sperm is okay, it's okay for life. And then they don't bother to check these things. So what do you also recommend? Do you recommend men to also check, or what's your counsel to men generally with regards to their checks to know their fertility status from time to time, and then to also keep themselves fit? I mean, when I say keep themselves fit now in relation to fertility, because yes, they can everything can be fine today and things can suddenly change. So what's your general counsel to the men?
Well, generally, men, as they age, just like women, their
Mm,
fertility potentials also drop.
mm,
Yes, it might be very obvious for the women because as a woman is born or a
mm,
girl child is born, she doesn't have more eggs and she keeps shedding those eggs up until when they get depleted and
mm,
fertility almost shuts down, what we call menopause. But for
yeah.
the men, there's also a concept called andropause.
Mm,
Even though, yes, for the men, it takes a longer time to
time.
come, but the quality of the sperm cells has a role to play in
Play.
fertility and conception. And
Wow.
after 50, for that, for most men, it drops. In fact,
Mm,
the age is now even further reduced for the men too, because our lifestyle, we are becoming westernized, or well,
mm,
the westernized lifestyle is beginning to hit all parts of the globe. So refined diets and all of that, cigarettes, alcohol, and all of that, all those
mm,
things have a role to play. Then for infection check for the men, most times because the men, when they have this sexually transmitted infection, they tend to have symptoms. So it's
mm,
easier for them to present and get treated. Even though for the men that are poorly treated, they could also have issues with conception and
mm.
also have even what we call strictures in the urethra and
Wow.
difficulties.
Mm,
Yes.
mm,
So if you identify all these things, because the men will eventually have symptoms like painful passing urine with a lot of pains and difficulties,
mm.
they should present to a standard facility where they'll be properly treated. Because getting some antibiotics might reduce your symptoms, but if it's not well treated,
It
you
could
might still
reoccur.
have the complications that would follow.
Mm,
Men should also check their semen quality by doing a semen analysis. Then, of course, when you pick problems, every other investigation can follow, like the blood works, looking at
Mm,
the hormones, and also scans of the scrotum, looking
okay.
at looking out for those enlarged veins that can
Mm.
cause affect the quality of your sperms.
Yeah, I know at some point you mentioned some of their some diseases that they should treat, or some conditions that they should treat, like hypertension, diabetes. Because okay, I know you said then, I know you mentioned earlier when you were
Yeah.
speaking that it could have impact too on their fertility in a
Yes.
way, some of
So
the medications and all
true,
that.
yeah. So some of these medications they use for hypertension can
Mm.
affect erectile
Oh
function and all
wow.
of that.
Mm.
Then diabetes alone can cause what we call backward
Hmm.
ejaculation. The word
Wow.
is retrograde,
Oh
and it
wow.
means that the men don't ejaculate in so
Hmm.
you can have an
Back.
absent semen or
Hmm.
sperm cells absent in an
Absent.
ejaculate.
Wow.
So those medical conditions need to be in check too,
Check.
not just the
Hmm. And they
women,
shouldn't be
for
careless
them
about it.
to
So
improve
men,
their fertility too.
wow. So men, you shouldn't overlook some of these things when you as your should I say now, as they are growing up as adults, as they live daily. Yes, don't ignore some of these conditions, hypertension. But make sure they are under checks, because sometimes with the way we deny some of these conditions, everybody, I'm healed in Jesus' name, and then we ignore some of these medications, and then complications are coming down, but because we are also ignoring the things that we're supposed to do, we're further complicating issues, and then later on we're falling back to the doctor when it's already really bad. So I think for the men, that's a lot. That's a big take home from Dr. J for you. Please do not ignore. Make sure you attend to them appropriately. Okay, so as we wrap up, what's your general counsel to the general public or to our viewers with regards to fertility and screening as a whole? Now, this is we talking to both the men, the women, the parents, and their children in general. Yes.
Well, from all our discussion, we could see that screenings very important. Early detection of problems would will afford treatment, appropriate care, and prevention of a lot of problems that would arise in the absence of treatment. So I want to counsel everyone to go out there, get regularly checked. Once you're healthy, your fertility chances are optimal, and also even when you get pregnant, you also have chances of having healthy babies. Thank you.
Yes. Thank you so much, Dr. Jen. It was really an amazing talk with you today, and I know our viewers had a very good time. And I know that we have had enough reasons to want to keep up with our routine checks, with our gynecological checks and our routine general health checks. It's not something to play with, it's not something to overlook. So I know that someone has noted that today, and I know there's a change right now happening with someone. You're going to keep up with your routine, and then you check yourself properly so your fertility is preserved, because we're here always to make sure that your fertility is in check. And that's why it's a day with your fertility specialist. On behalf of House Hospitals, I love to say a very big thank you to our viewers. Thank you for keeping us intact. Thank you for keeping us right now to this point. It's been amazing having you all with us. The list is endless. I cannot call the names of all of you right now, but just know that we appreciate you all for joining. Thank you for joining, and we look forward to seeing you and even more of you in our next session. Have a lovely evening. Bye.